Pretty scary condition. This month is Oral Cancer Awareness Month, and joining us live in Grand Island to talk a little more about it in Ascaddock is Dr. C.J. Steck from Steck Family Dentistry. Good afternoon, Doc.
Good afternoon. How are you?
I'm doing great. Let's talk oral cancer. How common is oral cancer?
Right. Well, oral cancer is diagnosed in 40 to 50,000 cases per year. On average, 60% of those cases have a survival rate of longer than 5 years, and it actually is twice as common in men as it is in women.
Is it like any other cancer? We don't really know what causes it, Doc? What do you think here?
Well, one of the things we know about oral cancer is that we have some pretty good risk factors that are able to tell us, what causes it. And some of those risk factors are, heavily drinking alcohol, especially in conjunction with smoking, and smokeless tobacco. That's another big part of it, another risk factor. And the human papillomavirus, or HPV virus, does have a strong correlation. And surprisingly enough, 25% of oral cancers occur in people that have no risk factors whatsoever. So,
right, Doc, how is oral cancer treated?
Well, it all comes down to early detection. If you can catch any kind of cancer, especially oral cancer, early, the treatment isn't near as invasive. You can go in and they can take out the cancerous lesion, and then sometimes they'll follow up with chemo or radiation. But anytime you have the surgical removal done in the head or neck area, it can leave someone pretty disfigured if it's not caught early enough and it's not small enough. So.
Right. Dr. Steck, if you should probably go in, if you detect a lump or something strange in that region?
Right.
What do you think?
Right. We want people to do a couple different things at home. One of them is check themselves out regularly, because you know your body better than anybody else. So we want you to look in the mirror with a nice with a light so you can see, and we want you to look for any kind of white patchy areas, or if you have any sores in your mouth or any bumps or lumps or anything like that. If they don't go away and they stay around for a while, you want to get in and see somebody that they can further evaluate that for you.
Some self-examination, sure. What do you do in your office, Dr. Steck?
Well, in our practice, every time somebody comes in for an examination, part of our routine is we do a oral cancer screening for them. That includes checking all over the mouth and the jaw joints in the face and around the lips, down the neck. We're feeling everywhere for any of these lumps or bumps and any tenderness and we talk to you about it, and especially those who are in those high risk categories that are maybe heavier drinkers or smokers, or if they like to chew tobacco. Some of those things are good reasons for somebody to go in and see their dentist a little bit more regularly.
All right. Thanks so much for being with us, Dr. C.J. Steck, Steck Family Dentistry. Thanks so much.
Yeah. Thank you.
All right.